In the realm of medical advancements, Nuplazid has emerged as a promising treatment option for a range of conditions. With its potential to address various mental health disorders, Nuplazid has garnered attention from doctors, researchers, and patients alike. In this video, we delve into the uses, benefits, and possible side effects of this groundbreaking medication that seeks to improve the quality of life for those suffering from debilitating conditions. Understanding the uses and benefits of Nuplazid. Nuplazid, also known as pimavanserin, is primarily used for the treatment of Parkinson's disease psychosis, PDP. PDP refers to a complex condition characterized by hallucinations and delusions that often occur in individuals with Parkinson's disease. These symptoms can be distressing and significantly impact the patient's quality of life. Nuplazid works by targeting specific receptors in the brain, helping to reduce the severity of psychotic symptoms without compromising motor function. This targeted approach makes it an attractive option for individuals with PDP. Beyond its use in PDP, Nuplazid has shown potential in addressing other mental health disorders. Research suggests that it may offer benefits in alleviating symptoms of Alzheimer's disease, major depressive disorder, and schizophrenia. While further studies are needed to establish its efficacy in these conditions, initial findings are promising. The potential expansion of Nuplazid's uses could have a significant impact on mental health treatment, offering new hope for patients and their families. Research and clinical trials on Nuplazid. The development and approval of any medication require rigorous research and clinical trials to ensure its safety and effectiveness. Nuplazid has undergone extensive testing to establish its therapeutic potential and to assess any potential side effects. Multiple clinical trials focusing on different conditions have been conducted to gather data on Nuplazid's efficacy. For example, a study published in the New England Journal of Medicine investigated the use of Nuplazid for treating Parkinson's disease psychosis. The results showed a significant reduction in hallucinations and delusions compared to the placebo group. This study was a pivotal milestone in establishing Nuplazid as a viable treatment option for PDP. Additionally, ongoing research is exploring the potential benefits of Nuplazid in other mental health disorders. Preliminary findings indicate that it may help reduce psychotic symptoms in patients with Alzheimer's disease and major depressive disorder. These studies provide a foundation for further exploration and potential expansion of Nuplazid's uses in the future. Potential side effects of Nuplazid. Like any medication, Nuplazid comes with potential side effects that need to be considered. It is crucial for patients and healthcare providers to be aware of these potential drawbacks to make informed decisions regarding its use. The most commonly reported side effects of Nuplazid include nausea, constipation, and confusion. These side effects are generally mild and tend to subside over time. However, it is essential for patients to communicate any concerning symptoms to their healthcare provider to ensure proper monitoring and management. In rare cases, Nuplazid may increase the risk of developing a heart condition called QT prolongation, which can lead to irregular heart rhythms. This risk is higher in individuals with pre-existing heart conditions or those taking other medications that can also cause QT prolongation. Therefore, it is crucial for healthcare providers to assess each patient's individual risk factors before prescribing Nuplazid. Precautions and considerations before taking Nuplazid. Before starting Nuplazid treatment, it is essential to discuss any pre-existing medical conditions and medications with your healthcare provider. Certain medical conditions or medications may interact with Nuplazid, potentially increasing the risk of side effects or reducing its efficacy. Open communication with your healthcare provider will help ensure that Nuplazid is the right choice for you. Additionally, it is crucial to follow the prescribed dosage and adhere to the recommended treatment duration. Abruptly stopping or adjusting the dosage without medical guidance can lead to adverse effects and may not provide optimal results. Regular follow-ups with your healthcare provider will allow for monitoring of your progress and any necessary adjustments to your treatment plan. How to use Nuplazid effectively. To maximize the benefits of Nuplazid, it is important to use it as directed by your healthcare provider. Nuplazid is typically taken orally, with or without food, once a day. It is essential to take the medication at the same time each day to establish a consistent routine. It may take several weeks for Nuplazid to reach its full therapeutic effect, so patience is key. If you do not notice any improvement in your symptoms or experience worsened side effects, it is crucial to communicate this information to your healthcare provider. They may need to adjust your dosage or explore alternative treatment options. Alternative treatments and therapies for similar conditions. While Nuplazid shows promise in treating various mental health conditions, it is not the only option available. Depending on the specific condition and individual circumstances, alternative treatments and therapies may be considered. For individuals with Parkinson's disease psychosis, other antipsychotic medications may be prescribed. However, it is important to note that these medications can have side effects that may interfere with motor function. Therefore, Nuplazid's unique mechanism of action, which targets psychosis without worsening motor symptoms, makes it a preferred choice for many patients. In addition to medication, non-pharmacological interventions such as cognitive behavioral therapy, CBT, and supportive counseling can be beneficial in managing symptoms of mental health disorders. These therapies aim to provide individuals with coping strategies, emotional support, and a safe space to explore their experiences. It is important to discuss these options with your healthcare provider to determine the most suitable treatment plan for your specific needs. Nuplazid availability and prescription requirements. Nuplazid is a prescription medication and is not available over the counter. To obtain Nuplazid, you must consult with a healthcare provider who can assess your condition and prescribe the medication if deemed appropriate. The availability of Nuplazid may vary depending on your location and healthcare system. It is important to consult with local healthcare professionals to understand the availability and access to Nuplazid in your area. Insurance coverage for Nuplazid may also vary, so it is advisable to check with your insurance provider to determine the level of coverage and any potential out-of-pocket expenses. Patient assistance programs and manufacturer discounts may be available to help reduce the financial burden associated with Nuplazid. Patient experiences and testimonials with Nuplazid. Personal experiences and testimonials of patients who have used Nuplazid can provide valuable insights into its effectiveness and tolerability. It is important to remember that individual experiences may vary, and what works for one person may not work for another. However, hearing about real-life experiences can help provide a broader perspective on the potential benefits and possible side effects of Nuplazid. Many patients have reported positive outcomes with Nuplazid, particularly in managing hallucinations and delusions associated with Parkinson's disease psychosis. They have noted improvements in their overall quality of life, reduced distress, and enhanced social functioning. However, as with any medication, it is important to remain cautious and consult with healthcare professionals for personalized advice. Conclusion: the future of Nuplazid and its impact on patient care. Nuplazid represents a significant advancement in the treatment of mental health disorders, particularly Parkinson's disease psychosis. With its targeted approach and potential benefits in other conditions such as Alzheimer's disease and major depressive disorder, Nuplazid offers hope for improved mental health outcomes. While Nuplazid has shown promise, it is important to consider its potential side effects and engage in open communication with healthcare providers. Precautions and considerations before starting Nuplazid treatment can help ensure the best possible outcomes. As research continues and more data becomes available, the future of Nuplazid looks promising. Further studies and clinical trials will help establish its efficacy in different conditions and potentially expand its uses. The impact of Nuplazid on patient care is likely to be significant, offering new possibilities for individuals struggling with mental health disorders and their loved ones. In conclusion, Nuplazid has unlocked a potential pathway to better mental health outcomes. By understanding its uses, benefits, and possible side effects, we can make informed decisions and pave the way for improved patient care in the realm of mental health treatment. Thanks for watching.